pain is a relatively, common condition. Out of 10 people coming to the orthopedic OPD, 9 people who have back pain, low back ache, what we call it. Many a times now everybody is sitting at home. They are doing work from home. They are sitting in front of a computer or a laptop and reaching the laptop or bending forwards, lifting things. So all these things are affecting the muscles in the back. They also affect your spine. So this common complaint is the back pain. If you're not taking frequent breaks, if you're bending forwards, if you're lifting something heavy, if you're not exercising your back muscles, if you're not sleeping for 8 hours, then you might get this back pain. The trigger for this back pain might be something like traveling for long or maybe sitting for long. But you feel that suddenly in the morning when you were taking bath and you were lifting the bucket, you feel a catch. Or you are getting up from the bed or a chair, you feel a catch, and that the muscles are stiff and you're not able to move your back. That is the main complaint. Many times patients they come with a complaint of radiating pain in the leg or tingling numbness or weakness in the leg. They are having immense pain that they are not able to walk or even put leg on the ground. So that is a severe form of backache. Those patients also come with a disc prolapse. So most common cause for the back pain is having any extra load on your spine. So that can be either riding a two-wheeler, riding a four-wheeler, sitting on a chair for long hours, bending forwards and doing things, or it might be just because you're not having 8 hours of sleep or not exercising it properly. Weight gain is also one important cause for the back pain. Young people are the most, prone to sit for long hours. They think that they are young, they won't have any problem. But young people also tend to ride a two-wheeler. They also tend to do extra activities, except, except for sitting for long hours, they are also doing all the hiking. They are also riding a two-wheeler, riding a four-wheeler, jumping, jogging, running, trying to lift weights in the gym. So they are more prone for getting back pain injuries frequently. And this pain for young people, they might have intermittent pain. So every 2-3 months, they would get a catch in the back. They would have to visit a physio or a orthopedic surgeon. Many times, incomplete treated back pains or incomplete treated muscle spasms, they come on and off every 2-3 months. So young people are more prone for getting back pain injuries and back muscle spasms, and they have to be very careful in what activities they are doing. Yeah. Back pain is first and foremost is because of our lifestyle. We are not meant to sit for long hours. Our spine is not meant to have that much of load. If you hold a glass of water in your hand, you can hold it for a minute or 2 minutes. After that, you feel discomfort, and then you have to keep the hand down. The glass has to be kept down. So if your body has to sit for long hours, your muscles have to work for those many hours. If you're not giving them break, if you're not exercising, if you're not allowing them to rest and again replenish the stores of your muscles, then you might have this back pain. So most common cause is sitting for long hours, sedentary lifestyle, not exercising, not moving around while sitting and reaching a laptop or reaching a keyboard. So anytime you're bending forwards, you're going against the shape of the spine. The shape is meant for an upright posture, but working on a laptop or a keyboard, you're just reaching the laptop or bending forwards. So all these spine muscles, they get overly used and fatigued easily. Other thing is going to the gym. We feel that gymming is the only way to increase the muscle strength, which is the wrong notion. For that, the main culprit is weight training. So if you are directly starting to do multiple exercises which are loading your spine more than normal, you'll get this kind of back pain easily. Other important cause, like I said, is weight gain. So if you have gained weight, all your spine muscles have to adjust the weight. The center of gravity of your body shifts because of your weight gain, and then you have to increase the muscle strength, which if you're not doing, then you get back problems or back pain. Then lack of vitamin D. If you're not going outdoors in the sunlight, you're just inside, not exercising, then this vitamin D deficiency would cause these muscles to remain fatigued, and it would be taking more than normal time for it to recover. And that's why people, they visit the orthopedic surgeon. Treatment in my practice, in my clinical practice, I always explain the patient why this has happened and how to prevent this. So treatment also includes medication, treatment also includes exercises, physiotherapy. But main thing is to understand why this has happened. So many times IT professionals or people who are sedentary, who are doing too much of loading of the spine, they are asked to take frequent breaks. Every 25 minutes, you have to change your posture. Just stretch your arms, stretch your legs, come back and sit. Every day, like you brush your teeth without fail, like you eat for your lunch and your dinner without fail, you have to exercise your muscles. And exercise doesn't mean weight training or starting with the heavy duty exercises. Walking is the best exercise what we can start with. You also sit in the sunlight. So vitamin D natural sources, sunlight. So you can sit for like half an hour, 45 minutes. You can walk in the sunlight. That helps in increasing your bone strength and your muscle strength. Other thing is, like I said, 8 hours of sleep, sound sleep. If you're sleeping for 8 hours, but your shift is night shift, your body is confused whether you are having day or night. And then these muscles are still activated. Once you wake up, you don't feel like fresh. You feel tired. You feel not to work. You feel just there's a catch in the back. And suddenly, if you do anything extra, then you get this muscle spasm again and again. Then if there's a disc prolapse, if you are riding a two-wheeler on a irregular surface road or riding for long duration, riding for long kilometers, then you might get a disc prolapse for which the treatment is strict bed rest. We might require to do a surgery. There's a disc prolapse. If it is just a mechanical back pain, exercises, precautions, and rest would help. But if it is a disc prolapse, many times patients may land up for a discectomy or a surgery to remove the prolapse disc, the which disc is pinching on your nerve. To correct the posture or to have less amount of pain while working, I can give you an example of you going to a movie theater. So, which seat you would like to prefer when you are going to a movie theater? It's not the first row or the second row; it is always the last one, right? The same thing. If you are sitting in front of a screen or in front of a computer, your neck should be always supported with a neck support chair. You have to sit with an erect posture. Your neck should be straight. You are meant to keep your neck extended. It should not be flexed like this. You also have to see to it that you have a good lumbar support or back support in your chair. You don't have to use a chair which is having a very hard cushion. It can be firm but soft cushion. Next thing is frequent breaks. Every 25 minutes you have to get up, just stretch your arms, stretch your legs, come back and sit. And then you can just continue you work for like long hours. If you're taking intervals in between. I'm not saying even half an hour, it is just 25 minutes. What you can follow. Okay. Next thing is for maintaining posture, you need to do the back extension exercises. For anyone who tries to start exercises, they start with the forward bending exercise, which increases the load on the back muscles again. It increases the load on the spine. Other thing is squats or going down against the gravity. So all these exercises are giving more effort on your spine muscles. So these exercises are strict no if you're starting it, what do you say, immediately after recovering with the pain. And for maintaining posture, like I said, ergonomics is very important. If you're working on a laptop or a keyboard, your your elbow should be near to your belly. You have to rest your wrist. You have to keep the keyboard near to your body, and then you can type. It should not give any more effort on your lower back muscles when you are typing or doing things. Okay. Even riding a two-wheeler, you should not ride in a speed where you are getting impact on the spine muscles or discs of your spine. If the disc prolapses, the disc is like a jelly. This jelly, if it comes out, it's not going back. So it becomes an irreversible change in your spinal process. So your spine has to have normal discs. To maintain that normal disc, you have to exercise your muscles and you have to maintain your posture with the ergonomic chairs or ergonomic workplace, whatever you are doing. You want to increase your muscle strength, you want to increase your back muscle strength, or you want to increase your strength in the bones. First and foremost thing is vitamin D. Vitamin D helps in getting the calcium, whatever you're taking inside the bones. So vitamin D should be available readily all over the, what is it? places with sunlight. So if you're sitting in the sunlight for half an hour, 45 minutes, that is sufficient. You can see people coming to Goa or any beaches and they are just taking sun bath because there is no readily available sunlight in other countries like what we have in tropical country like India. So remember, vitamin D easiest source is sunlight. If you're not going outdoors, you have to have some supplements, which is vitamin D once a week for 3 months. You can give a break of 3 months, and again you can start those. Next thing is protein. Your muscle is all protein. So if you are eating a lot of carbohydrates, if you are gaining weight, that means your protein intake is less. That means you have to increase your protein intake. If you are exercising, you need some protein intake. So in that case also you need some more protein so that you can build up your muscles, and these muscles they don't give you trouble later on. For bone strength, you can take calcium. If you're a non-vegetarian person, you can take calcium through the food. You can eat eggs. You can also eat meat. You can eat chicken, fish. All these are rich in calcium. Many a times patients they are coming with deficiencies of vitamin D and calcium. If you're taking, you have to take the supplement. Like I said, every day you can take it for some 3 months, give a break again, and you can start it again to increase the stores in your bones for calcium. Next thing, what improves your bone strength is exercises. So weight bearing exercises. Once you're better, first start with the stretching exercises. Then you can go for the strengthening. Last thing would be weight bearing, where you can lift the weights and or you can do your push-ups. So wall push-ups is the easiest exercise for your back muscles to remain strong. You can also do weight training exercises once a month or 1.5 months is over with all your stretching exercises and strengthening exercises. Weight training is the last resort because if you try to gain your weight, you're again putting more load on your spine. So exercise, the whole aim of exercise is keeping you healthy. Should not be otherwise. So that's why keep exercise to the weight training exercise to the minimum, but keep it optimum with your own weight. So endurance exercises you can do it, which is wall push-ups. You can do planks, side planks. You can do even if you are doing yoga, you can do the extension exercise like Dhanurasana, Naukasana, or Bhujangasana. All these are extension exercises that will help you in the long run for maintaining the muscle health and in turn increasing your bone strength.